Good evening, everyone. Again, I'm Dr. Victor Mack. I'm director for the STEM pre-college program at UNC Charlotte, and want to welcome each one of you all to our second virtual Thursday for the Spring 2025 Saturday Academy program, and our concluding activity for this particular semester. Want to thank each one of you all for, again, a very productive and very fruitful Saturday Academy session for this past academic semester. Want to thank each one of you all for your diligent attendance and participation. And also with it, all of these activities culminating with with us winning the first place overall trophy at the NC State competition that took place back on April 26th. So again, want to applaud each one of you all again and celebrate that victory that we had against the other pre-college sites at NC State University, Winston-Salem State University, and Elizabeth City State University. And want to applaud you all as much as possible as far as what you all have been able to accomplish. Tonight, we do have one speaker, Dr. Janelle White. She has a background in pediatrics, and she's going to be sharing information with you about her career. And I'm hoping that each one of you all will not only provide or give you undivided attention, but also unmute yourselves as far as asking questions at the conclusion of her presentation, and also bring up your video so that she'll be able to see each one of you all and be able to personally engage and connect with each of you. I do have a few announcements, two in particular, revolving some of our summer programming. We've already concluded most of our summer programming or enrollment for summer programming for this summer. Our activities start up on June 23rd and will run through July 18th. We still do have enrollment taking place that'll run through next Friday, May 23rd, for a physics camp or physics 1 camp that'll take place for any high school students that are interested in it. And also we have a new program called Math Data Detectives that will take place with some of the faculty there at UNC Charlotte that our office, the Center for STEM Education, will actually be sponsoring. You'll see links for both of those two programs on our website. I provided a link there in the chat. So if any of you all are interested in it, please share that information with your parents. We'd love to have each one of you all participate as far as that's concerned. So again, Physics 1 and also Math Data Detectives will take place June 23rd through the 27th, and go to our website at that particular link and you'll be able to sign up for those two engagements. Also, our fall enrollment was actually supposed to open up today. Unfortunately, we're still having some issues with rolling over our enrollment process to TeamWorks, a new platform that we're using for the enrollment purposes moving forward. So please be patient with us as far as that migration is concerned. We are anticipating it being active now on May 27th. And we'll actually conduct that enrollment period through July 31st. And so again, you'll see a link for that also up under that announcement, also in the chat. So again, for those that are interested in re-enrolling for the fall program, our Saturday Academy program, whether it be the middle school component, data science, biomedicine, or engineering, again, you'll see that link in the chat as far as being able to enroll in those 4 programs. So if you have any questions, again, please feel free to reach out to me as far as that's concerned, okay? I'll also, for those that may have just joined, I'll repost that particular announcement in the chat in just a moment. All right. I believe that's it as far as my announcements. Again, for those that are just joining, please make sure that your name is actually posted as far as your user tag on your particular screen. If you have any questions about how to do that, click those 3 dots in the upper right-hand corner of your particular box, and you should be able to change your username. We use a Zoom report as far as attendance is concerned, so Again, it helps us out greatly as far as being able to assure those that are in attendance with that proper name up in or up as far as your user tag is concerned. Again, also, once Dr. White starts her presentation, we'd appreciate if you could bring your videos up so that you all can engage with her during her presentation. Okay. So at this time, I would like to introduce Dr. Janelle White. She's the Chief Medical Officer and is also affiliated with the North Carolina Division of Health Benefits. Her background is in pediatrics and has had an extensive career with Atrium Health. So at this time, please give Dr. White your undivided attention. Dr. White.
Thank you, Dr. Mack. Good evening, everyone. Thank you so much for being here tonight and joining tonight's call. Please know that it is not lost on me that everyone on this call, you've had a full school day, probably maybe had an athletic practice or something that you had to go to, and you probably have some homework to do after this concludes. So please know that I realize that. So despite that, you all still showed up. So please know that that is appreciated. And I hope that what I share with you tonight will be helpful to you and that you will you will learn something and take something away from it. Also try to make it a little engaging so that I'm not talking at you, for the entire time. So as we get towards the end of my presentation, I'm going to ask for your help. I'm going to present a few patients to you, and I'm going to ask you to tell me what their diagnosis is, right? So we're going to talk through that. So again, just want to make it a little interactive, but I'm going to talk a little bit about what it is like to be a doctor, specifically a pediatrician. That's what I can speak best to because that is my profession. But also we'll just talk about sort of the path to get here. Selfishly and personally, I think being a doctor is the best profession, but again, that I'm a little biased. So, but I hope that I will inspire and encourage, some of you to consider this career path. To have the opportunity to take care of people and to make a difference. So also want to congratulate you all on your victory that Dr. Mack mentioned in your contest to win first place in the state. That is pretty incredible. So congratulations. And then Dr. Mack, thank you for allowing me the chance to participate and share tonight with the students. All right, so with that, just give me a second and I am going to share my screen. All righty. And can you all let me know if you see my slides?
Yes.
Okay, thank you. All right, there we go. All righty, so again, going to talk about the day in the life of a pediatrician. Also going to speak to a couple of other different specialties other than pediatrics. But again, this is the one that I can speak to the most, right? Because it is what I do as a living. So just to give you a little bit of an idea of what it is we're going to talk through tonight. So just a little bit of an introduction, tell you a little bit about myself, and then just go into what is a physician, right? And then, where do we work? There are so many places that we work. There are so many different things that we can do. Sometimes we have a concept or an idea of what doctors do, but it's actually a large range. And again, you can have different interests, different work styles, and you can find something that you would be interested in and that resonates with you. Some of us like to do procedures and cut things, and then others of us don't, right? So again, through this career, you can find so many different areas where, you will find your interest and that you would be happy. How did I get here? What is the path to becoming a physician, and what is it that we do, right? What is the work environment that I work in? What does it look like? What type of patients, would I see? What are some things that people would come to me for? And then I just want to make sure that I also leave plenty of time at the end if anyone has any questions. So that's just what we're going to go through. So again, as Dr. White mentioned, Dr. Mack mentioned, I'm Dr. White, and I am a pediatrician by training. So Um, I take care of children, of their doctors, ages 0 to 18. But again, in line with what I'm going to share in this presentation, there are so many different things that you can do as a doctor. So what I do currently is I serve as a chief medical officer for a type of health insurance. Again, you can do many different things over the course of your career. And again, that is what I want to hope that you all take away today from this presentation, is that the options are limitless. And I hope that you find yourself in one of these options. So with that, what is a physician? So we hear the word doctor, we hear the word physician, sometimes used interchangeably. So all physicians are doctors, but not all doctors are physicians. And I'm sure you know that, right, Dr. Mack? There are different types of doctoral degrees. But again, someone who is a physician is someone, they are a doctor, but they are trained and licensed to practice medicine. And what a physician does is we help prevent, we diagnose, we treat, and we also manage injuries, diseases, illnesses. So again, just sort of at the basic definition, that is what a physician does. Again, there are many, many different types of physicians. And what I've listed here on the slide really doesn't even scratch the surface. There are actually over 135 specialties and subspecialists. So I've really just listed a few here, and these are maybe some of the most common that you'll see. But, radiologists, there are different types of radiologists, right? You can be a radiologist who specializes in breast cancer. You can be a radiologist who specializes in bone, someone who is an interventional radiologist where you do procedures, dermatologist. You can be a pediatric dermatologist, right? Or you may specialize in skin cancer. There are many different types of surgeons. Some are listed here. There are orthopedic surgeons, so those are the bone and joint doctors. There are plastic surgeons, right? There are pediatric surgeons. So again, there are so many, even within what I've listed here, there are different types of doctors, even within these specialties. For myself, a pediatrician, general pediatrics, or I may be a pediatrician who wants to specialize in allergies and immunology, or I may be a pediatrician who specializes in the digestive system, gastroenterology. Infectious disease pediatrics. Again, the options are limitless. So I may want to study the diseases of the blood. That would be a hematologist. So again, just wanted to lay out here that there are many, many different types of physicians. And again, not even listed here on this slide, there are over 100 different types of physicians that you would have the options for. So what do I do personally? Again, I'm a pediatrician, so I'm a physician who is trained in the health and medical care of infants, children, and adolescents. So as you can see here on this slide, as your pediatrician, I take care of you as soon as you're born. I don't deliver the babies, right? So an OBGYN, an obstetrician, gynecologist delivers the baby, but as soon as that baby is delivered, handoff is to me. So I get the baby and I take care of the baby in the nursery. And as you can see here on the slide, then I have you as a toddler when you have that first day of school, elementary school, middle school, up until graduation. So between the ages of 0 and 18, that is the population that a pediatrician, myself, would take care of. Where do we work, right? Where do physicians, where do doctors work? So, many of you may be familiar with your doctor's office that you go to, right? I'm sure you go in for your checkups, or if you have a headache or a stomach ache, you go to your doctor's office, which is what we call a clinic. Some of us may have been to the emergency room, right? You injure yourself, or, you have something that needs immediate attention. Some doctors work in emergency rooms, hospitals, but outside of that, there are also places where doctors work. So you can be a hospital administrator. So you can oversee the functions of a hospital. You can work for a government agency. You may enjoy research, right? You may not want to see patients. You might have the medical knowledge, but you prefer research, right? So there are many doctors who work as researchers. insurance companies, pharmaceutical, I'm sure you all know this, but just in case, pharmaceutical means medications, right? The drugs and the medications that we take to cure diseases. So again, to understand what a disease process is, you can help that pharmaceutical company help develop the medicines that will cure that disease. There are many doctors who are educators. You may work at a university, you may work at a medical school. And then again, there are doctors who work internationally in different countries. You may volunteer, or again, you may work in a very remote country. And again, there are programs called Doctors Without Borders, right? So again, there are just so many different options and so many different places that doctors can work and that doctors do work. Again, when you get that medical knowledge, there's so much that you can do with that. So how did I get here, right? So just going to talk very briefly through how I got here, and then also just, sort of what the path to becoming a doctor is. So if you look at the bottom left of your screen, I'm going to begin where you all are, right? High school. So I was born and raised in Miami, so I grew up in Miami. So 4 years of high school. And then after high school, you go to college. So I attended University of Miami for college. And then after college, I went directly to medical school, and I attended University of Florida College of Medicine. And then after medical school, then you do what's called your internship residency. So as a pediatrician, my residency was 3 years to be a pediatrician. So the total time of your residency can vary. It can be 3 years, it can be up to 6 years, depending on what it is that you specialize in. So if we're looking at the numbers on this slide and we're counting the years, it's at least 15 years. And that might sound like a very, very, very long time. I'm sure it does, but it is worth it. Again, I think this is the best career ever. And it is worth every moment that you spend learning about this. So, it may sound like a very long time. However, the training that you get, and you're not in school the entire time. As a medical student, you do have time in the hospital. As a resident, all of your time is literally like working and seeing patients, but you're still in training. So it isn't 15 years of just entire school. So I don't want you to think that either. But again, just wanted to give you a little bit of a flavor of sort of what the timeline looks like. With this, everyone takes different paths, right? I went all the way through, straight through. There are some of us who may take a gap year, right? After you graduate high school, you might take a year off to sort of figure things out, which is perfectly fine. There are some colleges that even have accelerated programs where you might do only 2 years of college. Instead of 4 years, you only do 2 years of college, and then you do 4 years of medical school, right? So again, there are different paths. So this is not the only path to get here. This is just my path. So just want to make sure that I'm clear about that. So, where you are right now, high school, grades are important. It really does make a difference. And the extracurricular activities, what you're doing now, participating in this program is very important. All of this matters, right? And community service is very important, right? So, I think I just want to send the message here. Yes, grades are important. I'm not going to sugarcoat that, but colleges and schools also look for well-rounded students. So they also want to know, what else are you doing that's outside of the classroom? How are you expanding your knowledge? How are you taking advantage of different opportunities? Again, as you're doing in this program, right? You all are doing the exact right thing. And how are you being a citizen of your community? How are you giving back to your community? So community service is very important. So again, this is where you are at this stage, and you're totally on the right path there. Now, once you go to college, again, I attended University of Miami. What I want to call out here is when you go to college, you don't have to major in science. So that's something that a lot of people might think, I have to be a science major. I have to major in biology, or I have to major in chemistry. You actually don't have to. If you want to be a music major, that is perfectly fine. And you can still be a doctor. So, but the thing is, in order to apply to medical school, in order to sit for the medical medical college admissions test, there are certain courses that you have to take. So again, you don't have to be that science major. However, there are courses that you have to take. So the four here that I have bolded, biology, chemistry, including organic chemistry, physics, and math, those are those core classes you have to take. And then most medical schools, probably all of them, want you to take some type of English, social studies, humanities, maybe a biochemistry or something like that. This is not an exhaustive list of classes, right? There are others, and again, each school may be different. So once you get to college, make sure that you figure out what are the required courses that you have to take. But my point here is we don't want to be focused only on science, the English, the humanities, the social sciences. That stuff is very important. And again, it rounds out your experience and it makes you a stronger student. Once you finish college and you decide I want to apply to medical school, right? And their grades are very, very, very important. There, I'm going to tell the truth. Grades are important. But also, again, what are you doing as community service? What type of extracurricular activities are you taking? And then to apply to medical school, you have to take a test we call it the MCAT, the Medical College Admission Test. So this is a test that has four sections that are listed here. It's a multiple choice test, computer-based exam. I'm not going to read everything on here, but again, it is heavy in sciences, but there's also a verbal reasoning, a critical analysis and reasoning skills part of it. And again, that sometimes is the most difficult part of the test, right? You would think the organic chemistry would be the most difficult, but again, that critical analysis and reasoning skills can be sometimes the most challenging. So I just say that to say, to make sure that you are strong and make sure that you take those English and social science classes and make sure that you understand the reading comprehension. And this is important because when you become a doctor, you will read a lot of journal articles, right? And you're going to have a lot of scientific information thrown at you, right? And you have to be able to read that information, interpret it, and make the best decision for the patient that you have in front of you. So again, it is very important to build that muscle. Sciences are important, absolutely, but also don't forget the other side of it, where you got to make sure that you have that reading comprehension and those critical analysis and reasoning skills. All right, after we finish high school, after we've finished college, and we've gotten our acceptance letter to medical school, yay, right? We're getting there. So now we're in medical school. So medical school generally is a 4-year program. So the first 2 years, years 1 and 2, are traditionally what we call our preclinical year. So what that means is you're not in the hospital setting just yet. You're not in the doctor's office. You're still in the classroom, and you're in the classroom quite a bit. I'm going to be honest with you. So, the first 2 years are what we call those preclinical years. So you're learning a lot about the basic sciences. What is the body structure, function, how does it work, right? And how does it respond to disease? You're learning some foundational clinical skills, right? So you're learning how to take a patient history, how to perform an exam, and how to just understand basic clinical concepts. We're still continuing years 1 and 2. So this is not an exhaustive list. I just want to be clear there. You take many more classes in this. I'm just giving you a flavor of some of the classes that you take and some of the things that you will learn. So you may learn about anatomy. So that's actually one of the first classes you take is human anatomy. And with that, you actually do a cadaver dissection. So you dissect a human being, and you learn about the human body and how it works. And you learn every single part of the body. You have to be able to identify it and understand what it does. So that's a pretty intense class. We also take classes such as physiology, biochemistry, histology, take a slice of tissue and look at it under a microscope. And also, you will learn pharmacology. So those are medicines, right? How do medicines work? What is it that they do? How do they cure diseases and their use in medical treatment? You also learn about microbiology, right? So I think we all know about bacteria that causes infections, viruses that cause colds, the COVID virus, right? You learn about different bacteria and viruses. And then you also learn about the specific organ systems, right? So go through, and again, this is not a complete list, just giving you an example of some of the organ systems that you learn about. And then when you get into years 3 and 4, then those are what are called your clinical years. So that's when you get out of the classroom, finally out of the classroom. You still have some classwork, but it's not as intense. But years 3 and 4, that's actually when you finally get to step foot in a hospital, right? You get to step foot in a clinic, and you actually get to interact with patients, and you get that hands-on experience to actually see, how does this work? What is it that doctors actually do? So during your 3rd year, there are 6 rotations that you have to take. So we all, regardless of what it is that you ultimately choose to specialize in, you have to do a rotation in internal medicine. So that is uh, the medicine where you take care of adults only, surgery, family medicine, where you take care of the entire family from birth to adult to elderly, pediatrics, my specialty, where you specialize in children's ages 0 to 18, psychiatry, where you specialize in mental health, and then OBGYN, where you specialize in women's health. So again, those are the clinical rotations. And again, that gets you in the hospital, that gets you into those operating rooms, it gets you onto the hospital wards, it gets you into the clinics and the emergency department. And you get to, again, get a bit of a flavor of what it feels like to be a doctor. Also get advanced clinical training. So you're learning some more complex processes, more complex diseases, right? And, in your first year and 2, you learn how to take what's called a patient history. So what is it that brings you in today? Or you said your chest hurts. Where does it hurt? How long is it hurting? When did it start? Does it move around? But as you get to years 3 and 4, in addition to the history, now you got to start thinking, okay, what could this potentially be? So that's where you're developing your diagnostic plan. What is the diagnosis here? What is it? And then, more importantly, what am I going to do about it, right? Your treatment plan. So again, you just start to advance in those skills. A very important part of years 3 and 4 is specialty exploration, right? So, there are the basic clinical rotations that we have to take that I talked through earlier, but then there are other rotations, right? Many of you may be interested in dermatology, right? Or you maybe want to be a radiologist. You may want to work in the emergency room, or be a pathologist, right? So this is where you can start to maybe look around and think, okay, what is it that I maybe want to specialize in? And this allows you to sort of, rotate in those areas, and shadow doctors in those areas to decide what it is that you want to do ultimately. As a doctor, as a physician, you will take many, many, many tests to get there. And once you become a physician, they don't end. Every 5 years, I have to take a standardized test. So I know you all have PSAT, and you have upcoming ACT, SAT. They don't stop, right? So you go from the PSAT to the ACT, SAT, then you go to the MCAT, and then once you pass that, in order to get a medical license in this country, we have to take what's called the USMLE. That is just, again, another standardized test, and it's in 3 steps. So we have to take 3 of them. So the first one you take after your 2nd year of medical school. Step 2, you take after your 4th year of medical school. And then step 3, you take after you've had that first year of residency. So again, just giving you a little bit of a flavor of some of the courses and the exams and the standardized tests that you have to take. Now, after you have gone through medical school and you've decided, I want to be a pediatrician, right? So I use years 3 and 4 of medical school, and I rotated through OBGYN, I rotated through surgery, I rotated through my dermatology rotation, and I decided for myself, pediatrics, that's what I want to do, right? So after medical school, you do what's called a residency. So with that, you actually, once you've chosen the specialty that you want to be in, then you get to actually focus on that during your residency. So I did my residency here in Charlotte at Levine Children's Hospital. And again, the the shortest time a residency can be is 3 years. And then again, some of them can be 5, 6 years, depending on what it is that you choose to specialize in, right? So if you decide that you love dermatology, right, then you would do a dermatology residency, and that one is about 4 years. OBGYN, that's 4 years. So if you want to do emergency department, that's 3 years. If you want to be a hematologist, right, that one would be 6 years. So again, it just depends on what it is that you choose to specialize in. And then again, just wanted to give you, I'm not going to read this, but just to give you an idea of what the first year of residency for a pediatrician looks like, and then that PO2, what the second year looks like, and then what the third year looks like. So, again, this is sort of, we're finally getting a little bit to the end of the road there. So after you finish your residency, now you're finally a real doctor, finally. After all of these years and after all the tests and going through all the hoops and hurdles, you are finally a real doctor. So, what is a typical day? What does that look like? And just want to, spoiler alert, and I'm sure Dr. Matt can relate here, that there really isn't a typical day that doesn't exist. But I will talk you through, you never know what's going to come through your office door, the hospital, but I will talk through some of the most common things that you may see, as you're a doctor. So I'm just going to begin with emergency medicine. So emergency medicine, generally, if you like to work in a hospital, if you like a fast-paced environment, if you're that person, you don't know what's going to fly through the door, right? And that's what drives you, and that's what gets you going, then that's probably the place for you, right? Anything can come through the door. You can have a 2-week-old with a fever, and then you can have, a motor vehicle accident or trauma come through your emergency room, right? And you pivot from one to the next. So, this is sort of what your work environment may look like. As an emergency medicine doctor. And that picture right there below the ambulance, I just want to point that out. So just look at the amount of equipment in that room, right? So we have to be ready for whatever comes through the door, right? So you have to do procedures. If someone comes to you unconscious, you may have to do what's called intubate them to put them on a breathing machine. You might need to start IVs very fast. You might need to be able to repair if they come in for stitches, right? So there isn't, just look at the amount of that equipment that's there in that room. And again, those are the tools that are at our disposal as emergency room doctors, because we have to be prepared for anything that flies through that door. So just an example. So, when we're working in the emergency room, we have what's called the board, right? So that we know what's in my emergency room. So just to give you a flavor of what you may see. So in room 1, I may have a 57-year-old who came in with chest pain, right? Room 2, I just had the ambulance bring in someone who's seriously injured. They were in a motor vehicle accident. Room 3, I have a 7-year-old who has uncontrolled seizures. Room 4, severe abdominal pain. Room 5, shortness of breath. Room 6, I fell off my bike and I have a head injury, right? Room 7, I was doing fixing something and I cut myself. So I have a laceration, I need stitches. In room 8, I have a leg fracture. If you're in the emergency room on 4th of July holiday, we see a lot of these hand burns from firecrackers. It never fails, right? We see a lot of burns from firecrackers, fireworks, also significant eye injuries and facial injuries. So I just threw that in there. So depending on the time of year that you're working, you may have someone who just has pink eye, and they come in, and then you may have someone with dehydration. So again, just wanted to give you a little bit of a flavor of what you may have in your emergency room, and you got all this stuff going on at the same time, right? So just, that is the purpose of the length and the extensive training that you have, and you will be well prepared to handle this once you get to that point. Now I'm going to switch us over to radiology. So this is a bit of a different environment, right? So they may not want all the action going on. I want my day a little bit more predictable, or again, I just may enjoy images. You may enjoy engineering. And again, you use a lot of those skills with radiology, looking at the angles and lines and being able to measure if you see something on on a radiograph and to pinpoint it precisely, where that mass or that finding is. So this is what your work environment may look like, right? So you may have colleagues, and a lot of our radiologists work in what we call reading rooms. So I just wanted to share a couple of pictures of what a reading room would look like that you may work in as a radiologist. And then that picture there to the top right, those are what we call interventional radiologists. So these are individuals who are radiologists, but they actually do different types of procedures. So again, a very different environment, a very different skill set than you would see for an emergency room doctor. So I want to make this a little interactive. So I'm just going to ask someone to just come off mute, and let's look at this first radiograph of the arm. What is it that you see? Just come off mute and tell me what it is that you see. What you see there?
A broken bone.
It's broken.
Yes. Yep. So you see a
It's
fractured
broken.
bone. Mm-hmm. Yep. So you see a fractured bone there. So, again, these are the images that you may see as a radiologist. Let's look at the image on the far right. So that sort of oval, that's actually a CAT scan of a skull. That's just a slice of it. So someone tell me what you think happened there. So that's someone's skull, and that's their brain.
Maybe a brain.
A head injury or something?
Exactly, a head injury. So can you all see my cursor?
Yes.
Yeah.
Okay, right. So I'm going to this area right here. That's actually blood from a head injury. So that's not supposed to be there, right? So that's what we call a subdural hemorrhage. Again, if someone comes in with a significant head injury, you put them in the CAT scanner, right? And you get an image, then you can see right here that they actually have bleeding. So that's what that is here. This one here in the middle, this is actually an X-ray of a baby's stomach. I only know this from pediatrician. This is called duodenal stenosis, but you see that we call it our double bubble sign. So this bubble here and then this bubble here. So again, this baby would probably come to my office or the emergency room vomiting, not able to keep anything down. So don't know what's going on. I look at the baby's belly. It looks a little large, what we call distended, a little tight. Let me get an X-ray and just sort of look inside and see what I see. So as a radiologist, I can look at that and I find this, and I'm able to tell the person in the emergency department, this baby has duodenal stenosis. This X-ray here, this is a chest X-ray. So if you all can see my cursor, this is a shadow of your heart. And then this black here, that's air. So that's supposed to be there. That's air in your lungs. This opacity here, this area where my cursor is, that's not supposed to be there. That's supposed to be black, right? That's supposed to be air, but it's actually pneumonia. That's an infection, right? So if I have a patient come in my office, they have a fever, they've been coughing for 3 weeks, right? They have, chest pain. Then I'm going to let me get an X-ray and see what it looks like. And this helps me be able to tell that person you have pneumonia in your right lung. This last one here that I'm going to go over, this is just an example of different types of imaging studies. So this is more of an MRI, and this is normal, but I just wanted to show you just the level of detail. So this here in the middle would be someone's spine. These two things here are their kidneys. These are the hip bones right here, and then this is the bladder. So that's just the level of detail that a radiologist would be able to see within your body. All right, now going to pediatrics. So I'm to get a little bit more into my specialty and what I do. This top left picture here is actually the waiting room of the clinic that I used to work in, University Pediatrics. But again, just to give you a flavor, of what the work environment may look like. Again, we see those babies, as I mentioned, as soon as they're born. So this picture here on the top right, these are the babies in the hospital in the newborn nursery. They were just born, so we're examining them and making sure that they're healthy and all ready to go home after they've been born. So this is when I was when I was practicing pediatrics, this is what my morning looked like. Not my whole day. This is just the morning. So this is how busy we are. So, right, and we go on a schedule. So my first patient of the morning at 8 a.m., I have a 2-month well child check, right? And then my next patient is a 5-year-old. And then next one coming in, they've had a sore throat for 3 days. So I won't read all of this, but just to give you an idea of the variety of illnesses that we see, the variety of ages that we see, and the acuity, how we see it. Someone, they're just coming in because I was actually hospitalized, right? I had asthma and I'm hospitalized, so I'm following up with you. Someone, they fell off the monkey bars at school and they got to go into their pediatrician. I got to get that X-ray, right? So I can see, the one of the X-rays that we saw when we were looking under the radiology section. Someone ate a peanut they weren't supposed to. They have an allergic reaction, right? I got to be able to manage that. Someone's having stomach pain, or they've had headaches for a whole month, or, they fell off their bike and they got a laceration. They went to the emergency room, got stitches. They come to me so that I can remove the stitches, right? So again, just a little bit of an idea, of things that I would see on a typical day when I'm seeing patients. All right, so now let's see some patients. So again, I think I've talked at you all enough. So I want this to become a little bit more interactive, and I want to give you all a chance. I want to see what you got, and I'm asking for your help. I need your help diagnosing my patients, right? So I'm going to give you 4 patients. And 3 of them, I'm going to ask you to tell me what their diagnosis is. And Dr. White needs some help. Okay, so we're going to begin with patient number 1. All right, so Isaiah is 2 years old, and Isaiah's father brings him into your office because he's been crying all night. Isaiah has a fever, and Isaiah has been tugging on his left ear. Okay, so I have a 2-year-old toddler who is fussy. He has a fever and he's tugging on his ear. So anyone, just come off of mute and tell me, what is the diagnosis?
An ear infection.
Ear infection. Absolutely. Perfect. Okay. So yes. So Isaiah has an ear infection, or the technical term is acute otitis media, but an ear infection. So again, I'm sure you all are very familiar with this otoscope that the doctors we use to shine that light in your ear so that we can see. And the ear infection, if you can see my cursor, it usually happens in this space. So behind the eardrum is where that infection builds up, and that causes the ear infection. So you are spot on, perfect. So what are the symptoms of an ear infection? So again, generally, you have an infant or a young child, it hurts, right? Ear infections are painful. So they cry more, and they're irritable. They're usually pulling on that ear or touching it. If you're older, you are able to say, my left ear hurts, and again, if you're a baby, you can't talk, so you're just sort of crying and tugging on the ear. You can also have an elevated body temperature or fever, and then sometimes you also may have fluid drainage from that ear as well. So those are the typical symptoms of an ear infection. And then, okay, we've diagnosed the ear infection. How am I going to treat it? What am I going to do about this, right? So most ear infections are treated with what we call antibiotics. So generally, we'll give you a course of antibiotics, generally, 7 to 10 days, oral antibiotics that you take by mouth. Sometimes ear infections need antibiotic ear drops. And then again, for that pain and that discomfort, sometimes just a little Tylenol or ibuprofen, Advil, or Motrin will help calm down the pain and then also help manage that fever as well. So that's your sort of typical treatment for an ear infection. All right, good job, guys. Okay, we're going to go to patient number 2. All right, so Vikram, he is 8 years old, and Vikram went to school this morning, was doing okay, but at about 11 o'clock in the morning, school nurse called mom and said, you need to come pick him up. So Vikram was sent home from school today because he's been coughing all morning. And he even told his teacher, it's difficult for me to breathe. This has happened before, and it usually happens when he gets a cold. And then when you use your stethoscope and listen to Vikram's lungs, you hear wheezing. So with that, what is the diagnosis? What do you guys think? I need help.
Asthma.
Asthma. Perfect. Okay. Yes. So with Vikram, he has asthma. So if you can see this picture here, of the airways, those 2 pink things right here, those are called your lungs. And inside of your lungs, you have what's called your airways. And in a normal airway, if you can see here how it's nice and open and you can breathe in and out, no problem. Chest isn't tight, you're not coughing, you're just breathing normally. But what happens when you're having an asthma attack, that airway actually tightens up. So that's where you hear the wheezing, that's why you're coughing, and that's why you feel short of breath. Because again, instead of that airway being nice and open, you're trying to breathe through a smaller airway. So I usually explain it as if I were to just breathe through my mouth, I can breathe easily. If I take a straw and try to breathe through that, that's going to be harder, right? And you're going to hear that wheezing, whistling sound. And again, it's going to take more effort because I'm trying to breathe through a smaller device, that straw. So that's sort of, one way to understand asthma. So what are the symptoms of asthma? Again, difficulty breathing, may feel like you're not getting enough air, you're gasping for breath. Again, you may hear that wheezing, that whistly sound, coughing a lot, especially worse at night, in the morning, but cough throughout the day sometimes. And then your chest just feels tight. And again, you feel short of breath. So those are the asthma symptoms. So how do you treat asthma? So just remember those airways tighten up. So they constrict, they tighten up. So in order to reverse that, you need it needs to dilate, right? So, and then your airways are called bronchi. So bronchodilator, right? So you need something to dilate, to open those airways. So that's a bronchodilator, and it can be given in different ways. I don't know if you may have heard a asthma pump, someone may say that, or my inhaler. I'd use my inhaler and I breathe in the medicine. And then for babies, they're not able to use those inhalers. So they get what's called a nebulizer treatment, and it's like a mist, and they just have to sit there and breathe it in. Some patients also need a steroid to just calm down all of that gook and inflammation inside of their airways. And then if it gets really bad, some patients need oxygen. By that time, generally you have to be in the hospital. So again, this is high level. There are many other asthma treatments. So again, I'm giving you the very, very high level. I just want to be clear there. All right, last patient that I need your help with. Okay, so I have Amaya. Amaya is a 12-year-old girl, and yesterday throat started feeling scratchy, didn't think anything of it, went to school, did her normal routine, but then when she woke up this morning, throat looked red and it was actually hurting. It's painful to swallow. So she looked in the mirror, opened her mouth, and it looked really red back there, tried to swallow her breakfast, her cereal, and it really hurt. And then her voice also sounded hoarse. All right. So with this, just call it out. What is the diagnosis? Sore
Strep
throat.
throat.
Absolutely. Perfect.
Throat.
You guys got it. All right. So pharyngitis, sore throat, and again, it can be caused by bacteria. There are many different bacteria that can cause sore throats. The most common one that we hear of is strep throat. So I heard someone say strep throat. So absolutely. And then there are also times when viruses can cause sore throats, and with that, it might feel like strep throat, but it's actually a virus. So we actually test to see the cause of the throat pain. So that you all are spot on. So what are the symptoms of pharyngitis? So generally pain or scratchiness in the throat. If you look in the back of the throat, it looks red. The tonsils are swollen. It just hurts to swallow. You're trying to drink your orange juice in the morning, it hurts, right? Or you have a fever, might have headache. Those lymph nodes in your neck might get a little swollen. Your voice might sound hoarse, and you might have those white patches on your tonsils. So pharyngitis treatment. Again, your throat just hurts. You just want something to help it feel better. Generally, you want to take an over-the-counter pain reliever, again, like a Tylenol or Advil, Motrin, something like that. Usually drinking warm liquids may help. And then some people like cool liquids help them. Also, milkshakes help as well, too. A lot of my patients like to drink a milkshake, that usually helps soothe their throat. So that's their excuse. And then also sometimes running a humidifier or a vaporizer, salt water gargles, if you can. That's a little tough to do sometimes. And then again, if it's caused by a bacteria like strep throat, then you do have to take a course of antibiotics. But again, there are some sore throats that are caused by viruses, and they don't require antibiotics. So it sort of just depends. All right, so patient number 4, I'm going to talk you through this one. So Mr. and Mrs. Matthews bring in their son, Noah. So Noah is 2 months old. They just had him, brought him home a couple of months ago from the hospital, and he's just in for his checkup. So during Noah's visit, Mr. and Mrs. Matthews asked, what should Noah be doing at this age, right? Is his development on track? Is he doing the things that he's supposed to? So just to let you know, as a pediatrician, in addition to treating the illnesses and the sickness, we also have to be experts in if a child is developing normally, right? So, at 2 months, there are certain things that you can do. At 4 months, there are certain things a 4-month-old baby can do, so forth. At the age of 4 years old, right? There should be certain things that you can do. At the age of 6 years old, there are certain developmental milestones that you should be hitting. So when you come in for your well visits, your pediatrician, in addition to doing your physical exam, checking your ears, your throat, listening to your heart and your lungs, we're also asking the parents, what is Noah doing? So at 2 months, I would ask Mr. and Mrs. Matthew, do you see him lifting his head a little bit more? Do you see him moving his arms and legs? If I put something over here, is he able to follow it with his eyes, right? That's what we call tracking. If he hears a sound, does he turn his head towards it, right? Is he starting to smile? At about 2 months or so, babies actually start smiling and they start cooing and babbling and things like that. So just wanted to throw that in there that, as a pediatrician, in addition to just the physical things, we are also experts in making sure that those babies are meeting those developmental milestones. And if they're not, then we know that we want to refer them to get the help that they need. All righty, so I'm wrapping up here again. I know this is a long day, and you all have been very patient and interactive with me, so I appreciate it. So, for me, the best part about being a pediatrician is just the patience. I absolutely love it, and again, I hope that each of you found something in this presentation that resonated with you, and I hope that you find something that you like. But just know that there are so many different options that you can take if you choose to be a physician, and you don't have to follow, a certain path. So with that, I am going to stop sharing, and then I am happy to answer any questions that you guys may have. And I hope that you all found this helpful.
So guys, feel free to unmute yourselves and ask a question, or you can use the chat to put your questions in.
Hello.
Stella, go right ahead.
Um, I would like to ask, like, in your high school years, were there like any internship that you had to do to get more experience in like the medical fields and stuff?
No, you generally don't have to do anything. When I was in high school, I did volunteer in a hospital, and it wasn't because I had to, but I just wanted to um, make sure that that was what I was interested in, right? Sometimes you have an idea of what something looks like. So I think I want to be a doctor, but what is it that they actually do, right? I may not know what they do. So I use it as an opportunity to make sure that that was really what I wanted to do. So it is good to just get that experience, to round out your experience and to learn about what they do, but you don't necessarily have to. You don't have to.
Santosh, should I see your hand up?
What happens if you like do something wrong as a doctor? Do you like get sued for malpractice, or how does it work?
You can. Yep, that is certainly a possibility. If you do something wrong, then you can get sued. So that is why, it is important to make sure, and that's why people ask, why does it take so long to become a doctor, and why do I have to go through all this school? Because again, the thing is, want to make sure that you're very well trained so that when you are taking care of patients, you have the experience and the tools and the knowledge that you need, so that you don't make mistakes.
All right.
Sydney, I believe I see your hand up.
Um, For your first 4 years of college, like what did you major in?
I was a biology major. So again, I did major in science, but I thought you had to. So that's what I wanted to share with you all. You don't necessarily have to major in science. Yes, it does help. I enjoy science, so I don't regret it. I enjoy science and I obviously enjoy biology. But there are some people who love the humanities, right? And love music or whatever it is, or you may want to be an engineer, right? I have a good friend. She is a radiation oncologist and she was an engineer major, right? And that actually helps her a lot in the work that she does, because in order to deliver a very targeted treatment to someone, you have to have understanding of those concepts. So again, you don't have to be a science major.
Vinny, and I see your hand up.
What has been your most interesting case that you've had to diagnose?
Yeah, that's a very good question. The most interesting case that I've had is I had a I can tell you two, actually. One of them, I had he was 7 years old at the time, and he moved here from Egypt, actually. And his mother brought me in, and his skin was completely yellow. It was yellow, and she could not figure out why, So that's what we call jaundice. And I ran some blood tests and actually found out, that there were certain foods that this boy would eat, and it would cause his blood cells to break down, and it would cause his skin to turn yellow. So that is one that a very interesting case. And then a second one that always stands out to me, I was seeing a baby for his 2-month-old well visit, and his heart rate was about 200. And the normal heart rate is in the low hundreds, depending. So it was about twice what it was supposed to be. And I just remember my stethoscope was on, and I put my stethoscope on his chest, and his heart was beating so fast. I thought I was hearing something wrong. And his heart was beating just that fast. So, you do see some very interesting cases.
Any other questions for Dr. White?
All right. I really appreciate everyone's attention. Again, I know it is the end of your day, so you were very patient and diligent, and thank you for participating and helping me diagnose my 3 patients that I presented to you. You guys are great.
Guys, let's use your reaction buttons and show our appreciation for Dr. White sharing her time and expertise with us this evening. And feel free to also unmute yourselves and also share your thanks as far as that's concerned. And Dr. White, as always, you're always welcome with the pre-college program. And so anytime you'd like to volunteer or come back in a similar capacity, we'd love to have you. And so thank you. I really do appreciate it.
Absolutely. Was happy to participate. Thank you, Dr. Mack.
Thank you. I'm sorry. Someone else was about to say something. Okay. Guys, a friendly reminder again, we still have that math detectives and the physics 1 programs open. I'll put that information again back in the chat if you want to share that with your parents. I appreciate it. The data detectives in particular is pretty much filling up pretty quick. High school students, if any of you all are even thinking about physics, again, a great program and teacher will be facilitating it. Would love to have you. And again, fall enrollment for the program will open up on May 27th. We should have everything finalized with Teamworks and that registration process working smoothly by that time. So again, looking forward to seeing many of you all, not only this summer, but also this upcoming fall. So again, I want to thank you all for participating in tonight's virtual Thursday, and look forward to seeing you all soon. You all have a great evening.
Thank you. Bye.
All right, thank you.
Bye.
Thank you.
Thank you so much.
Thank you. Bye.
Thank you.